To excellence in care for patients, families, and the community. Now, the latest in medical innovation and information for your good health and well-being. This is KMAX Healthcast, sponsored by Covenant Health.
Breast cancer is the #1 cancer in women. Just this year, doctors expect 288,000 new cases around the world. Now, a new study finds that some women with breast cancer might not need chemotherapy after all. A breast cancer diagnosis used to mean aggressive chemotherapy to get rid of it, but a new study shows that's not the case anymore.
Chemotherapies are very hard chemicals that have both short-term and long-term complications, and if you're not going to benefit from that, then there is no point in doing it.
Dr. John Zab-Riaz is an oncologist at Covenant Health. He says not everyone will benefit from chemo.
But that test, the last 10 years or so, we are able to individualize the treatment where some of our patients may not need chemo. So especially the early stage breast cancer, then 14.3% are the intermediate category.
A genetic test categorizes patients as low risk, intermediate risk, and high risk.
And low risk are the ones that will not benefit from chemo, and they are very well managed by just the hormonal treatments. The high risk are the ones which always benefit from chemotherapy. So this is the segment of population where this trial has really benefited.
A large amount of patients fall into that intermediate risk category. Dr. Riaz says it wasn't always clear on the best way to treat them, so doctors would stay on the safe side and offer chemotherapy.
And we were able to eliminate about 70% of those patients that would have gotten chemo prior to the results of this study, that now we will be able to avoid all those extra treatment burden for those patients.
Dr. Riaz says this is something that Covenant has been doing with its patients for years, and he says this study helps clarify a lot of the confusion on what treatment is best.
It gives more reassurance both for the clinician and for the patient that by holding chemo, they are not taking a huge risk.
Dr. Riaz says early detection is the key. This is why it's so important to get those mammograms every single year. We'll be right back.